Since its emergence as a perplexing health issue in 1986, HIV/AIDS has become one of the most serious development crises facing India today. In the last decade itself, the number of HIV-positive cases have increased threefold, from 1.75 million in 1994 to over 5.1 million in 2005. The Government of India, along with state governments and other development partners, is committed to offer a concerted response to the epidemic. AIDS is recognized as a priority by the present UPA government that has constituted the National Council on AIDS, chaired by the Prime Minister, to spearhead the national AIDS response. Prime Minister Dr. Manmohan Singh, on several occasions, has reiterated his commitment to the HIV response.
Our government is committed to providing leadership to the national AIDS control effort. We have made this commitment in various international declarations and in our National Common Minimum Program.
There has been a rapid spread of the virus in the northeastern region of the country. The region's proximity to the Golden Triangle, porous borders, and widespread injecting drug use make it highly vulnerable to the HIV epidemic. Recognizing the need for a coordinated response to the problem, on the 19th of November 2005, a high-level meeting organized by the Parliamentarians Forum on HIV/AIDS and the National AIDS Control Organization brought together Northeastern Chief Ministers in Guwahati, Assam, and elected representatives for a day-long consultation on the AIDS response in the region. Dr. Peter Piot, Executive Director, Unaids, was also present as a mark of support to the elected representatives.
We are working, first of all, going to do more here in the Northeast. We are going to establish an office here so that we can do more, bring more support. We're mobilizing money for the state so that there can be better and more HIV prevention, particularly among injecting drug users, so that they will not share needles and infect.
In addition, Union Ministers Mr. M. Kindia, Minister for Tribal Affairs, Mrs. Panabhaga Lakshmi, Minister of State for Health and Family Welfare, and Mr. Oscar Fernandes, the Minister for Youth and Sports and the National Convener of the Parliamentary Forum on HIV/AIDS, participated in support for this historic meeting. The objective of the convention was to provide an opportunity to discuss cross-border issues related with HIV/AIDS and generate commitment among the elected representatives of the region to strengthen the AIDS response at the grassroots level.
We have to involve the NGO, social worker, teachers. We have to involve everybody also. Naturally, without involving the NGOs, social worker, particularly those who are committed. This is a work which is need commitment and dedication. Without commitment, without dedications, it is very difficult to contain this disease.
Here lies the problem. The awareness, the consciousness should be imbibed in the brains of the people, should have the courage to come forward, because they cannot be helped until and unless they come into the limelight and tell their ailment, their suffering. Then the government and the NGOs cannot help them until and unless they cooperate with them.
Dissemination of HIV/AIDS information in the constituencies. Exemption of local tax on HIV/AIDS related drugs. As per the decisions taken, several elected members are contributed fund towards the program and are also disseminating HIV/AIDS information and discussing issues related to the epidemic in their respective constituencies.
Manipur State AIDS policy came into effect from 3rd of October 1996. HIV is no longer confined to IDUs, but also spreading to female sex partners. children and general population irrespective of region and income.
We have to see that our government machinery, our NGOs, our elected representatives, we all come together to see how we address these vulnerable sections of the population, like the injecting drug users in Northeast, like commercial sex workers, like men having sex with men, people who normally do not exist so far as the elitist society is concerned. They are somewhere in the background, they are somewhere in darkness. And to approach them, we need to use the civil society.
We know, as all of you do know, that the positive people in your states and those that are at the risk of becoming positive are relying on your leadership and the services that are available in your states for the understanding about the danger so that HIV can be prevented, and for an environment in which positive people can live lives of respect and productivity, and for treatment of those who are sick.
Addressing the elected representatives, Dr. Peter Pyot appreciated India's response to the epidemic.
Last 2 days I spent some time in Shillong and Guwahati, where I met with quite a number of people and visited a number of community programs and the Assam Rifles. All great work that is going on. It's fair to say also that 2005, these years, that the global response to AIDS is moving into a new phase. A phase that I believe is characterized by a triple momentum. First, we have a political momentum in many, many countries. And the same is true here in this country and in the Northeast. And I think that this conclave, again, highlights this political momentum. And without that political momentum, I don't think we can ever defeat AIDS.
He called upon the elected representatives to offer concerted action.
It has taken the strong leadership of the top, of presidents, prime ministers, chief ministers, parliamentarians, who recognize the danger, break the silence, make the courageous decision needed, and deliver the right kind of response before the epidemic has become widespread and very difficult to control, because the longer we wait, the more difficult it becomes.
We have been wanting to set up a regional office for NACO in the Northeast, which could act as a nodal agency for the 7 states and focus on strategies and bottlenecks, ensuring identification of key issues and a smooth implementation process. I am happy to announce that the modality at our end have more or less than finalized, and we shall soon be creating the regional office at Guwahati.
It is our responsibility, the elected representatives, to take the necessary measures to prevent the spread of the disease. And the government's resolve, the UPA government's resolve has been made very clear in the minimum program adopted by the UPA and the government. This program to fight AIDS, HIV/AIDS, is a part of the common minimum program. The Prime Minister decided to form a council in which all the chief ministers are represented and people concerned with the spread of AIDS are included in the National Council. And with this framework, if we start working earnestly, we will be able to check the spread of the disease.
The consultation concluded with the adoption of the Guwahati Declaration by the elected representatives, outlining the way forward for regional action.